Syphilis is a sexually transmitted infection that has been around for centuries, affecting people of all backgrounds and ages. It's caused by a specific type of bacteria known as Treponema pallidum, which is invisible to the naked eye but can have a major impact on your health. This tiny, spiral-shaped germ is highly infectious, and, if left untreated, can lead to serious and sometimes irreversible health problems. Although modern medicine once nearly eliminated syphilis, it's now making a surprising comeback in many parts of the world, including developed countries. The good news is that syphilis is completely curable, but only if it's detected and treated early with the right antibiotics. If ignored, syphilis progresses through several stages, each more dangerous than the last, eventually affecting your skin, internal organs, nervous system, and even your brain, sometimes years after the initial infection. That's why regular testing, honest conversations with your healthcare provider, and awareness of the risks are absolutely crucial. Syphilis is often called the great imitator because its symptoms can look like so many other common illnesses, making it tricky to spot. For example, a rash might appear on your body and easily be mistaken for an allergy or a harmless skin condition, or a sore could show up and look just like a pimple or a cold sore, making it easy to overlook. That's why you can't diagnose syphilis just by looking at symptoms. Only a medical test can confirm if you have it. Many people with syphilis have mild symptoms or none at all, so the infection can spread easily and silently from person to person. Remember, syphilis is spread through direct contact with a syphilis sore during sexual activity, including oral, vaginal, or anal sex. The infection is completely curable with a course of antibiotics, especially when it's found early before complications develop. Because its symptoms can be so misleading, it's earned the nickname, the great imitator, making regular testing even more important. Understanding these facts is the foundation for protecting yourself and others, and for stopping the spread of syphilis in your community. Knowledge truly is your best defense when it comes to sexual health. Don't let a treatable infection become a lifelong health issue. Take action early, and don't hesitate to seek help. Stay informed, get tested regularly, and take control of your health and your future. Now let's dive deeper into how syphilis spreads, the risks involved, and what you can do to protect yourself and those you care about. Syphilis spreads through direct contact with a sore, called a chancre, which is often painless and can go unnoticed for days or even weeks. These sores can appear on the genitals, anus, lips, or inside the mouth, anywhere the bacteria enters the body. This means oral sex is just as risky as vaginal or anal sex for transmission, even if it feels less risky or is seen as a safer option. Many people mistakenly believe oral sex is safer, but with syphilis, that's simply not true. The risk is real, and it's important to understand how easily the infection can spread. If a sore is present, sometimes hidden or painless, bacteria can pass from one person to another, even if the sore is tiny or out of sight. You might not even know you or your partner has a sore, especially if it's inside the mouth or throat, making it easy to miss during a quick check. That's why syphilis can spread so easily and silently, moving from person to person without obvious warning signs. You don't need to see a sore for transmission to happen. It can be small, hidden in folds of skin, or even inside the mouth where it's hard to spot. Any direct contact with a sore during sex, oral, vaginal, or anal, can spread the infection, so using protection is crucial every time. Open communication with your partner and using barrier methods like condoms or dental dams are key for prevention, no matter what kind of sex you're having. Don't assume someone is STI-free just because they look healthy. Many people with syphilis show no symptoms at all. The silent nature of syphilis is what makes it so stealthy, allowing it to spread before anyone realizes there's a problem. Protect yourself and your partners by staying aware, talking openly, and always using protection, because when it comes to syphilis, what you can't see can still harm you. The first sign of syphilis is usually a single painless sore called a chancre. It appears where the bacteria entered your body, mouth, genitals, or anus. Because it's painless and often hidden, many people never notice it. The sore heals on its own in a few weeks, but the infection remains. Next comes the secondary stage. A rash, often on the palms or soles, but it can show up anywhere. The rash usually doesn't itch and can be faint or look like other skin problems. Other symptoms might feel like the flu fever, sore throat, swollen lymph nodes, headaches, or fatigue. These symptoms also go away without treatment, but the bacteria stay in your body. Syphilis is a master of disguise, making it easy to miss. After these stages, the infection can go silent. No symptoms, but still dangerous. Don't ignore unusual rashes or sores, especially if you're sexually active. Early detection is key to a simple cure. Get tested if you notice anything unusual. If untreated, syphilis enters a hidden or latent stage. No symptoms, but the bacteria are still there. For some, it stays silent, but for up to 30%, it progresses to late-stage syphilis years later. This stage can damage your heart, blood vessels, liver, bones, and joints. Sometimes permanently. The most serious risk is neurosyphilis, when the infection attacks your brain and nerves. Symptoms can include headaches, paralysis, memory loss, and even dementia. Ocular syphilis can cause vision changes or blindness. Hearing loss is also possible. The damage at this stage can't always be reversed, even with treatment. That's why early diagnosis and treatment are so important. Don't let a painless sore turn into lifelong health problems. The journey from a small sore to brain or heart damage is real, but preventable. The good news: all of this can be avoided with early testing and treatment. Don't wait for symptoms to get worse. Take action early. Suspect syphilis. See a healthcare provider. Diagnosis requires specific tests. If you have a sore, a doctor may swab it and look for the bacteria under a microscope. Most often, a simple blood test is used to detect antibodies your body makes to fight syphilis. There's a window period. It can take weeks after exposure for a blood test to turn positive. If you test too soon, you might need to repeat the test later. The CDC recommends routine screening for pregnant women, men who have sex with men, and anyone with new or multiple partners. Regular STI testing is a smart part of your healthcare routine. Early detection means easy treatment and no long-term problems. Don't wait for symptoms. Get tested if you're at risk. Protect yourself and your partners with regular screening. The best news: syphilis is easy to cure with antibiotics. For early syphilis, a single penicillin shot usually does the trick. If you've had it longer, you may need more doses or IV antibiotics for severe cases. If you're allergic to penicillin, other antibiotics can be used. Treatment stops the infection but can't reverse damage already done. That's why early treatment is so important. After treatment, follow-up blood tests make sure you're cured. Your sexual partners should be tested and treated too, or you could get reinfected. Avoid sex until your doctor says you're no longer infectious. Quick action means a full recovery. Don't delay. Syphilis is curable if you act fast. Protecting yourself from syphilis is simple but requires action. Use condoms or dental dams every time you have sex, vaginal, anal, or oral. Talk openly with partners about sexual health and STI testing. Don't assume someone is STI-free just by looking at them. Make regular STI testing part of your routine, especially with new or multiple partners. Ask your doctor for a full STI panel, including syphilis. If you test positive, get treated right away and notify your partners. Don't be embarrassed. Healthcare providers are there to help, not judge. Early testing and treatment prevent serious complications. Awareness, communication, and protection are your best tools. Take charge of your sexual health. Stay informed, stay safe, and help stop the spread of syphilis. Prevention is always better than cure.